So I just did hand hygiene, make sure I washed my hands. I have clean, non-sterile gloves that I just put on. This is our patient. This is Ellen Davis. I am her nurse. My name's Laura. Prior to me coming to work the earlier shift, they had received orders to start a peripheral IV. So they did so. They have a 20 gauge in the left forearm. It does have a label on it saying the date that it was inserted, the gauge, and the initials of the nurse that did so. We are going to make sure that it's patent prior to starting our IV infusion. So we'll go through those steps as well. So we're going to make sure that we have all our equipment before we get started with anything, so we don't need to leave the room. We can make sure that we're here. I want a sharps container. I want a trash receptacle. I want something to catch the fluid for when we prime the infusion pumps. I have tape. I have flushes of normal saline. I have the sodium chloride 500 bag. I have the gram of Ansef. I have the 10 drip sets or a macro drip set. I have alcohol wipes with the alcoholic 70%. I have clean gloves. And I have my IV pool at this point. So what we're going to do, I checked all the fluids. So we're going to start with our sodium chloride. We have the 500 bag. So with this, I'm going to make sure that it's clear, there's no particulate matter, that it's not discolored, it's the appropriate medication, make sure that it's not expired or anything like that. So once I know that that is all set, I'm going to also get my orders. So I'm going to confirm with my patient who she is. I'm going to make sure I have at least 2 identifications. So I'm going to ask her her name and date of birth. I'm also going to, when she tells me that, I'm going to confirm it with the orders that were given from our provider. So it says Ellen Davis. So I'm confirming with the patient that she is Ellen Davis. I'm checking her wristband, making sure it has her name, date of birth, and I'm checking for allergies. I'm also confirming this with the provider order. So Ellen Davis, we have Ellen Davis on the band, date of birth 9/1963, no known allergies, everything matches up. Sorry about that. So making sure everything matches up. So I've identified and done 3 checks. Check the name brand, going from there. We also want to make sure that with the order and the medication we're giving, so the sodium chloride infusion, we want to make sure we're doing the 6 R's. So right drug, right dose, right time, right route, right patient, right documentation. So I confirm with this, it is 500 mLs of sodium chloride. We'll check that, make sure none of anything is expired. So at this point, I'm going to take the fluid and I'm going to label it. We're going to include the patient's name, the date that we did that of today. We're going to make sure that we have the prescribed infusion rate, which is 125 mLs an hour. We're also going to do what the start time of the infusion was, as well as the end time, so in my initials. So we have that labeled, not to get anything confused with that. So Ellen Davis, it's 4:15:21. We know that this is our patient, 125 mLs per hour of sodium chloride. Start time is going to be 1400. It'll take 4 hours, so it's going to end at 1800. So once we have that all labeled, we can get one of our drip sets, which is the 10 drips. Get rid of that in the trash. So we're going to make sure that nothing touches anything. We're keeping the covers on until the last minute to keep things sterile. We're going to take the infusion bag of the sodium chloride. We're going to remove the safety lock. We're going to remove the spike cover of the drip set. And we're going to make sure that this doesn't touch anything to make sure it remains sterile. And we are going to insert this into the fluid. So now that we have that, we're going to make sure that our roller is all the way off right before we insert it. Make sure this isn't tangled. We're going to get on our IV for now. So this did fill up with some of the fluid. If it's this high, we won't be able to see it, so we will invert this to make sure that it's only filled up about halfway through the chamber. That way we're able to count the drips to make sure that we're ensuring the right amount. So at this point, we're going to prime our line. So basically what we're going to do is we're going to open up the roller, and we're going to let the fluid go all the way through to get rid of the air bubbles and to make sure that there's not air in the line so we don't risk for an air embolism. So we're going to open it slowly. We're going to allow for this to feed all the way through. Once we have that, you don't want to let too much out because you want the prescribed amount, which is the 500 mLs. That label would have been a little stickier. So we'll resecure that. So at this point, we're going to look for any air bubbles. If there is, you can do some flicking and so forth. We're going to make sure the cap is back on the end of this until we are ready for that step. And we're going to make sure that nothing is dropping or hanging from there. Before we attach anything to that, we want to get our patient in the most comfortable position now that we're going to start working with her. So Ms. Davis, I'm just going to put the rail down. Are you in a position of comfort? I'm going to make sure that the bed's elevated. We also have this clean linen just to catch anything for any mess that might happen with the infusion. So we're going to explain the procedure to Ms. Davis. We're stating that the doctor ordered her to receive some sodium chloride, which is fluid, to help while she's here. So we're going to say that this is taking about 4 hours, answer any questions, make sure we cover all the patient education portion. So at this point, we're going to come over. We're going to start assessing to make sure. I'm going to look at the dressing to make sure that it wasn't inserted over 96 hours ago. So we see that it's been 24 hours. It's a 20 gauge and the nurse initials on the dressing. We also are going to look around the area. Is there any swelling, redness, tenderness, any signs of inflammation or infection at this point? Is there anything oozing out? Everything's comfortable. Make sure that the IV is all set with that. At this point, we're going to assess if there's any signs of irritation on the skin or any allergic reactions because of the tape or the dressing that's on there. So we're going to get our flush, make sure that, again, it's the right content, make sure it's clear, that there's no discoloration, there's no particulate matter, it's not expired, anything like that. You want to make sure that the cover's still on to keep everything sterile in that sense. So we're going to come over, we have our alcohol prep pads, which is the 70%. Right before we do that, we are going to do some hand hygiene, change our gloves to make sure that they're new since we've been touching the wrappers. So at this point, we will hand hygiene, change our gloves. We'll take the alcohol prep pad, and for at least 15 seconds, we're going to take the port since this has been out and about with contaminants, or we want to make sure that we're not infecting anything or getting bacteria in there. We're going to wipe this all down, like I said, at least 15 seconds. Make sure you get all the threads. You're going to make sure you air dry this. Don't fan it. You want it to dry on its own. Now we have the flush with the cap still on it. We're going to remove the cap, make sure nothing's touching. And because this is clean and now dry, we're going to secure that on. With our non-dominant hand, we are going to remove the clamp, so loosen that to make sure that it's open, and we're going to flush the line. As we're flushing the line, we're going to make sure that the IV is patent. So this is going to tell us that the IV is good, that we can start the infusion. We're going to monitor, make sure there's no redness, swelling, or anything like that. At this point, we're still making sure that we're not touching anything that was sterile, and we can clamp it back off for the lock set and remove this. So now that we know we have a patent line, at this point we would, if for some reason had to relabel the dressing, if something happened, we would make sure that it still had the time of insertion, the date, the gauge, and the initials of whoever did so. So at this point, we relabeled if necessary. At this point, we're going to wash our hands, put on some new gloves, do hand hygiene just to make sure because we've been touching wrappers. We want to stay sterile. So at this point, new gloves are on. We're going to come over to our infusion, and we had the cover on this the whole time, so we know that this is still sterile. Again, we're going to take an alcohol prep pad. Before we do any of this, again, just for triple checking, we're confirming the name, the date of birth, and make sure there's no allergies. Confirming this against the provider orders, which we already said. So this is a 500 bag, and we want 125 mLs per hour. So in order to do that math, it'll be your total volume that you'd like, divided by how many minutes, and then you multiply that by the size of your drip set. So ours is a 10 drip set, so it would be 125, and then you divide that by 60 minutes, because 60 minutes is an hour, and then you multiply that by 10, and that's going to give you 20.83 drops per minute. So round up to right around 21. It should be about 1 drop every 3 seconds since we're using the gravity, but we'll show you the math for that in 1 second. So here again, using the alcohol, at least 15 seconds, we're cleaning the port just to make sure, and we're not touching it again, we're letting it air dry. At this point, we're still not letting anything touch that. We can take the cover of the infusion line off, and we can connect that to, make sure it's secured. At this point, we are going to label this line. So we're going to make sure that this is labeled the sodium chloride, just so we know. And again, make sure that we initial that, just because we know that a secondary infusion is coming, so we want to make sure our lines are kept separate and identified. Briefly, before we continue, this is the math for the sodium chloride. Again, that was 125 mLs. You can also do it times the drop set, divided by time, or the way that I just described. Either way, it comes out to 20.83 drops per minute. So like I said, roughly 1 drop every 3 seconds to get that. That'll take 4 hours to complete. Because again, 125 mLs per hour and a 500 ml bag. So we're going to make sure that the line is open. We're going to make sure that it's flowing. So we're going to make sure we open the roller. You can see up here the drops going. So you want to make sure that it's 1 drop every 3 seconds or so. 1, a little too fast. 1, 2, 3. 1, 2, 3. So that's about the rate that we want to go. Be mindful that if you change the position of the patient or if they move, it might affect the rate where it either makes it faster or slower. You make sure you secure this. You never want to put tape over the junction spot because then you can't see if there's any infiltration or anything like that. So we're going to secure this to a position of comfort to make sure that it's going to flow appropriately. So we have that hooked up. You want to continue to make sure that you're checking this with the patient. Again, 1 drop every about 3 seconds to make sure you administer this the right way. We also are going to make sure that we educate the patient during all this to make sure they know why they're getting fluid. We want them to be aware of, to let people notify quickly if there's burning, redness, swelling, tenderness, anything like that, or any fluid leaking from the actual IV site, just because we want to make sure that if it is infiltrating that we catch it right away. So again, we adjusted our flow meter. At this point, we can dispose of all our trash. We're going to practice hand hygiene. So there's that. Again, we informed our patient of everything. Return to a comfort position, make sure they have their call light. So Ellen has hers, or Ms. Davis has her call light ready to go. Again, at this point, we're going to continually assess for at least 15 minutes just to make sure that this is flowing appropriately. There's no adverse reactions. There were no interventions needed. And then we're going to move to our documentation. So we're going to make sure that whatever way we stabilized anything, we're confirming that. We're confirming that there was no infiltration noted on the IV, that it was a patent line, the size of the line, so a 20 gauge. We're going to make sure that we notify the type and rate of IV fluid. So we have the sodium chloride at the rate of 125 mLs an hour. If there were any adverse reactions, we would report this here. Any other interventions performed, we would put that here. Any patient education we did or patient teaching we would include in this. We know that it's a manual pump, so we would document that. Total volume infused is going to be important, and the date and time of the infusion started, as well as the rate and when you expect completion and the total amount. From there, if there were any questions, we could answer that again with Ms. Davis. And for